I am Dr. Vikram Huded, Director, Intervention Neurology, Narayana Group. So today I will be talking about carotid stenosis. Carotid stenosis is the blood flow to the brain is blocked. It may be 60%, 70%, 30%, 80%. So usually these patients will not have any symptoms. So once it becomes severe, or if the plaque is unstable, then it will produce a minor stroke in 25% of patients. Or in other patients, it produces full-blown stroke. So during general checkup, if you do carotid Doppler, we can identify these stenosis so that depending on the percentage of stenosis, depending on whether the plaque is stable or unstable, we can give medications. If it is very severe or if a person has got minor stroke, then we can do procedures if there is a severe stenosis. There are two types of procedure for carotid stenosis. One is angioplasty and stenting, which is similar to the cardiac, where we put a filter distal to the blockage, and then we'll take a balloon, small balloon. We do angioplasty so that the plaque is broken, and then we put a stent inside that blockage. So if there is any debris which go distally, the filter which are put distally will block those debris, and we remove along with that filter out if there are any debris. This procedure is a pinhole procedure. Here we don't use any blade. Here we use a needle to enter from the leg artery, and then we go inside into the brain artery using an X-ray fluoroscopy machine. This procedure is done usually in half an hour to 20 minutes time. And here the patient will be conscious when we do this procedure under local anesthesia. The second procedure, which is called carotid endarterectomy, here we cut open the skin and we remove the cholesterol plaque. So there are few indications where we do carotid stenting. There are few indications where we do the surgery. So it depends on the anatomy, patient's age, what is the morphology of the lesion. Thank you.